I'm going to tell you a story. It's a story about health and money. It's the first bit about health, because health is really very important in our lives. If we are not healthy, we cannot function. If we are not healthy, we are less likely to be happy. Is there anybody who has never been sick in his life? Never at all. So everybody has once at least has been sick. And when you're sick, imagine that you would stay like that the rest of your life. It would be terrible. So only when we're sick, we realize how important it is to be healthy. It's also about money, my story, and especially about the relationship between health and money. It's a kind of a strange relationship. We tend to say health has no price, health is so important, money should not play too much of a role in health. But there is this relationship, and it's some kind of a bizarre relationship, it's kind of bizarre marriage. And the question of my story is, can it ever be a perfect marriage? Health and money. That's the challenge, and that's what the story is about. I wrote a book about this, but I forgot a slide to make promotion for my book, so I hope that my few words are enough to make you remember that I wrote a book on this. So I start the story with good news. In fact, what not many people know is that when we invest as a government invests $1 in health, it gets in return $2 for the economy in the long run. So $1 leads to $2. We call this in economics the multiplier effect. Well, the multiplier effect of investing in health is 2. You get a return on investment of 100%. There's only one sector that does better, that's education. So it's stupid to save on education, because education has even a multiplier effect of 3. So that's the only sector that is significantly better than health. But my story is about health, and unfortunately, this is kind of the honeymoon part of the story. It's very good news, but there are conflicts. There are conflicts between health and money. And you can understand the conflict if you know about the key principles of healthcare. What are the 3 principles of healthcare when a government invests in healthcare? First one is quality. Of course, if we want good healthcare, it needs to offer quality. If we need a surgery, we hope that the surgery is done by a surgeon who was trained. We hope that in the hospital the risk for infections is very low, so we want quality, that's obvious. What is less obvious is the second one. It's called solidarity. And solidarity in this context means that 2 people with the same healthcare need deserve the same quality of healthcare, no matter their income, no matter their education level, no matter their background. That's the meaning of solidarity. That means that in a society, those who have more money contribute more to the system by taxes or social security, and those with less money, they can benefit from the system because in the end, when they have a health problem, they deserve the same quality as the other ones. Now, some people have a problem with that. They say, why should we pay for these other people who cannot pay for it? Well, if you're not that altruistic and if you indeed question that situation, then you should realize that, and it has been shown by a group from Rotterdam, from the Netherlands, that if we could reduce the health inequality, so the difference in health between the rich and the poor, if we can reduce that, it's good for the economy in its totality. So even if you're very selfish by nature, you should understand that making these differences between the poor and the rich in terms of health expectancy, that if you make those differences smaller, it's good for the economy in its totality. And then the third principle, is sustainability. And sustainability means that if you want to offer quality and you want to offer that for everybody, you want to make sure that in 5 years, in 10 years, in 20 years from now, we can still pay for that with our money that we all together spend on healthcare. And that's the challenge. And especially if you look at what is coming to us in the next 10, 15 years, it's enormous. We will have telemedicine. We will have regenerative medicine. So if your heart stops working, we can give you a drug that restores your heart. It regenerates your heart. That will be extremely expensive. We will have robots that will take over part of many other people that currently work in the healthcare sector. I wish I had such a robot who brings every evening a beer to me. I drink beer. But of course, I tried when I was just married, I tried to convince my wife that she had to bring a beer to me. And in fact, the situation now is that I have to bring a drink to her in the evening when she's tired. So I didn't manage it very well. But the thing is that a lot of things will change in healthcare, and this will be a threat for that sustainability because many of those technologies will be very expensive. And so the question is, what should we do to be prepared for that evolution? How can we maintain sustainability? And a key thing that we have to do is to tackle what we call the overuse. We have in our country And not only in our country, in many countries in the world, there is overuse, there is misuse, there is abuse in the healthcare sector. We see people be diagnosed with a disease where they don't have a disease. We see too many diagnostic techniques applied in people. So instead of just one imaging technique, like an echography, they do a CT scan, an MRI, and people are happy. I went to this hospital and they treated me so well, they did all kinds of things with me. No, they did too much with you. And that's waste. Unfortunately, that's money that is not well spent on healthcare. And if we could reinvest that money to do better things, that would really be a solution to maintain our sustainability for a much longer time. Okay, now, how should we do that? One possibility is to apply fixed budgets. I wish that would exist in a shoe shop. Like, after so many pairs of shoes, sorry guys, the budget is not anymore available, no shoes anymore. But in the healthcare, that's dangerous. Because if you would, and some countries try that, if you're in the healthcare, you give a fixed budget to a hospital, to a physician, what will they try? Will try to do not too much, of course, with that patient, but maybe too little, because they got already their budget. So if you're hospitalized for a new hip replacement, you get 5,000 euro to your hospital. Well, the hospital will try to get rid of the patient as soon as possible. They will try to do as little as possible for their patient, because they get their 5,000 euros anyway. So that's the dangers of that fixed amount of money that you could apply. So what's the solution? There is one important solution, and that's what we call cost effectiveness. Cost effectiveness is the balance between the costs of healthcare and the benefits, the health that you get, because what is the idea of healthcare? It's supposed to produce health. Okay, that sounds very economically, but that's what we do in the healthcare. We are producing health. But in any sector in economy, if you're producing something, then at least you have to try to respect productivity. Okay, how much does it cost to produce 1 unit of health, and is that cost acceptable compared to what we produce? So if a new drug, a medicine, is extremely expensive and only offers a little bit of health, we say it's not cost effective. If another new drug costs also more than today, but for every euro that we invest, we gain a lot of health, we call it a cost-effective drug. We call it value for money. Okay? Now the question is, how do you define value for money? Where do we put the threshold? As from which point do we say, this is not anymore cost-effective, this is costing way too much compared to the health that it gains? And there is a recommendation regarding this question from the WHO. So those who thought I made some grammar mistake in English, like who chooses, it should be like this, or whose choice? No, it's the choice project by the WHO, the World Health Organization. That's not an economic organization, as you know. And they say, we have to put a threshold, we have to make choices in healthcare, we don't have all the money of the world to spend on healthcare, so we have to draw a line somewhere, and we believe that you should draw the line where the GDP per capita is, the gross domestic product per capita. Everybody knows what the gross domestic product is. If we divide it by the number of people in the population, we have the gross domestic product per capita. In Belgium, it's around 40,000 euros. So the average Belgian citizen has an economic value of 34,000 euros. We all believe we have a much higher value, but that's the average for the Belgian citizen, which is slightly more than France, but less than the Netherlands. That's bad news. But then they say, you cannot live as a country above your standards, so you have to respect that GDP per capita, and that's a good approximation of the value of a healthy life here, because it's the value of one citizen per year. There's another method by a French group. They asked the European population, how much would you be willing to pay for 1 extra year in good health? Oh, all the money of the world. You don't have all the money of the world. So the method has been developed since already the 70s. It's called the willingness to pay method. And of course, it takes into account the ability to pay of a person. And then the final result was around 40,000 euros. So one healthy life here has an economic value of 40,000 euros. What we have to do in the future is to make that much more explicit to the innovative industry. Dear industry, we want your innovation, but please know that we have our societal limits. And if you develop an innovation, please try to respect that threshold, the maximum value that we can pay for a healthy life here. So that's a very important solution. So what we have to do, we have to get rid of that waste, that overuse, and the money that we can get there, we have to reinvest in many important things. We have to reinvest it in more quality, in more equity, so that the poor get the same amount of quality of care as the rich. In fact, a country that doesn't believe in that solidarity, that country is morally totally retarded. And by the way, they also their economy will suffer from it. So we need to invest in equity. We need also to invest in prevention. We can drink alcohol, but not too much. Okay, we have to try to eat a little bit more healthily. We have to try to practice exercise a little bit more, but we have to try to convince people to do that, and we need campaigns, and that also requires money. And then finally, of course, the money that we can get from getting rid of the waste, that money we can reinvest in the new innovations that are coming to our healthcare sector in the very near future. Okay, so did I really say how we have to do that? So take away the waste and then reinvest? No. So many things are needed to do that. First of all, as I said, we have to apply always that principle of cost effectiveness. Secondly, we need, ideally, every Belgian citizen, and ideally that should also be done in other countries, should have a general practitioner, a family physician that takes care of you. He should be your medical coach. If you're young, you don't need him really, but the older you get, the more you will see that you need a medical coach. He will protect you against waste. And he will tell you where you get the best quality for costs. But that means that everybody needs to have this physician that has this role of medical coach. And this physician will be supported by the e-health system. And the e-health system will make sure that we all have an electronic medical file and that physicians can communicate about our health via this electronic medical file. And also that policymakers who have then an oversight of all these electronic medical files, of course with respect for privacy, that these policymakers can see what's going on and can identify the waste and the overuse much more rapidly and also tackle it. So that's why we need a perfect healthcare system. If we don't know everything about every patient at any time, we cannot have good health policy. So that's why we need that e-health system. And this physician, that is our medical coach, he should then get one fixed amount of money per year per patient. I was talking about fixed budget and I didn't really like it, but here my proposal is that the general physician gets a simple amount per patient per year. And so the more he does, he doesn't get more paid. He just gets paid by patient in his practice. What is the use of that? He will promote patient empowerment, he will promote prevention, he will make sure that people will not get sick, and he will really play the role of medical coach. Of course, you see the lasso there. So capitation, we call it capitation, one fixed amount of money per capita, capitation. It can be not so motivating for a physician, and that's why we have to combine it with what we call P4Q. What is P4Q? It's pay for quality. If, as a physician, you make sure that your patients are well treated, not over-treated, not under-treated, but well treated with cost-effective treatments, then at the end of the year you get a bonus. That's already starting now in some countries. It's called pay for quality. And that's also to be combined with all the rest that we need. And then, of course, these physicians will not anymore work alone, they will work in networks with nurses, with physiotherapists, with dietitians, and so on. So more and more in the future we will need networks in order to make, again, this healthcare more cost-effective. And then we also need new professions. Some nurses will take tasks over from the physicians. Or administrative tasks. A physician should not do administrative tasks. There should be somebody specialized in administration who will take over the administrative tasks. So that's also something that we need in the future. Also, the patients, they need to get empowered. There are now experiments with what we call the expert patient program. We try to educate patients so they get to understand their disease much better. They can also train peers, other patients with experience in the same disease, and again that can help to avoid overuse and to avoid undertreatment. And then finally we have our healthcare insurance companies. They also have to play a role of a broker. They have the data and they can show in this hospital you get good quality for a reasonable cost. So dear general physician, your patient with heart disease, the best hospital to get is there, because we know the data, we compared the quality data of the different hospitals. So as you see, there is a lot of things needed, and the final thing that is needed is something very attractive. It's called P2SM, pay to SM. So don't understand me wrong, it means we pay healthcare programs that can not only offer quality, but also immediately save money. Typically, fall prevention in elderly. So you train elderly to get stronger muscles again, and it has been shown that you reduce the number of falls by half, and in the first year you get your money back already with a factor of 2. Or having people who need renal dialysis, not having the renal dialysis somewhere in a hospital, but having it at home. It's perfectly possible. So there are many interesting programs where we can encourage the program because we know in the end we will save money. So what's the conclusion you think about this money and health? Is it a good marriage? Well, I think it's a forced marriage. We have no choice, we have no alternative. We have to combine money and health. But what we're sure of also is you need a wedding planner, and I mean the government here. This is a sector where we need a government, and we need also a marriage counselor all the time, and then it can work. Thank you very much.